Not now. Not now. Okay? Not now. I'm lying. Gotta record this. Okay. We got chapter 7, page 175. All right. Page 175 of your nursing assistant book. After this recording, again, you can go home and record and rewatch it, study, and prepare yourself for your state exam. Basic nursing skills. So being a nursing assistant is not all about ADL care. There's more to it than ADL care. Okay? When you work in a nursing home, you do a lot of ADL care. But when you work in the hospital, you do a lot of ADL care, but you do more basic care. And by basic care, we're talking about other things that the nursing assistant can do. Helping with admission, transfer, and discharge a patient. Helping with doing vital signs, okay? Providing different types of care to a resident, okay? So admission is the first thing we can do. Okay, what is admission? Admission is basically the first time a patient comes into the nursing home. When a patient comes into the nursing home for the first time, they're not very happy, right? They're not very happy. They don't want to be there. They're very unhappy, okay? And a lot of times that causes them to be confused and they fall, all right? So what can we do at time of admission? Well, before your patient comes in, okay, the nurse receives a report that tells us about the patient. You need to get a report from the nurse also, okay? Is it going to be a man or a woman? Is the patient on wheelchair or can the patient walk? What does the patient eat? Okay? Does the patient use a regular bedpan or fracture bedpan or brief or bedside commode or can walk to the bathroom? Is the patient independent or needs assistance or is dependent for ADL care? Okay? Is the patient fresh out of surgery? Does this patient has a surgical incision, a cut on the abdomen? So the nursing assistant needs to know a few things about the patient coming in. Okay? So let's look at the guideline, page 175. Prepare the room for the patient. Okay? Now, by prepare the room, when we get report about the patient, we know what to get. If it's a woman, she needs a bedpan. If it's a man, he needs a urinal, right? If this patient is on wheelchair, maybe we can try to find a wheelchair in the facility for this patient. Let's clean up the room. Let's make the bed, right? Washcloth, towel, toothbrush, toothpaste, cups, right? So we get things, extra journeys, okay? When the new resident arrives at the facility, you know, the time and her condition, okay? If she's using a wheelchair, stretcher, or is walking, who is with her, etc., right? Look for signs of nervousness. Number 3, introduce yourself, state your position, smile and be friendly. Page 176, turn the page. Never rush the process with a new resident. She should not feel like she is an inconvenience. Explain the day-to-day life of the facility. Offer to take the patient and her family on a tour. Show the resident important areas. Handle personal items with care and with respect. Okay? Admission can be stressful. All right? So observe the resident and report what you notice to the nurse. If there was any disconnected tube when the patient came in, let the nurse know. If the patient is confused, combative, let the nurse know. difficulty breathing, pain, bruise, wounds. All right. So the same thing that you do on a day-to-day basis with residents in the nursing home, right? You will do that and then observe and report any changes. Okay? All right. So, admitting a resident, identify yourself, wash your hand, explain the procedure. 4, provide privacy. 5, if part of the facility procedures, do these things. Measure height and weight. So vitals, so new patient will need a height, they will need weight, measure vital sign, temperature, pulse, blood pressure, respiration. You may need to get urine specimen, complete paperwork like an inventory list. We're on page 177. Okay? Help the resident put personal items away. Provide fresh water. Show the resident the room and bathroom. Explain how to work the bed control, the call light, etc. Right? Introduce the resident to their roommate if there's one. Make sure resident is comfortable. Place the call light within reach and do your finishing steps. All right? Transferring a resident is the second part of it. Transferring is basically patient is going from first floor, maybe the second floor, or patient is going from one room to another. Okay, so they may be transferred to a different area of the facility. In cases of acute illness, they are transferred to the hospital. So when transferring the resident, page 178, go to page 178, okay? After you do your beginning procedure steps, right? Number 4, collect the items to be moved onto the cart. So basically, what item are we going to move? Their clothes, all right? Their purses, phones, and things that belongs to them. Not the bed sheets, not the pillows, all right? All of these things belong to the room on that floor, okay? Help the resident to onto a wheelchair. Introduce resident to the new staff after they get there, all right? Help the resident put their personal item away and make sure resident is comfortable, and then you do your finishing steps, right? So transfer is just getting the resident ready, maybe doing the ADL care, getting the resident ready, pack their stuff, put the patient on the wheelchair, carry their stuff, and bring them to the new place. Discharge. To discharge a resident to a family, the doctor from a facility, a doctor must give the discharge order. What is discharge? Discharge is a patient who is feeling much better now. Patient can now go home. So discharge, patient is going home. Admission, patient is coming in. Transfer, patient is going somewhere else, like maybe another room, another floor, right? Now, your patient will have questions. And when they ask you these questions, they need information. It is not your job to give this information, okay? Patient will need information, page 178, okay? Patient needs information about future doctor's appointment, physical therapy, speech therapy, occupational therapy. You don't know anything about that. As a CNA, it's not your job. Home care, medication, instruction on ambulation, medical equipment, transportation, restrictions, diet, nutrition, community services. When the patient asks you these questions, you need to take the questions to who? The nurse. Okay? You report it to the nurse. All right? Nursing assistant helps by collecting the resident's belongings, packing them carefully, and should know that what the resident condition is at the time of discharge. All right? Is the patient stable? So you Need me to move? You're messing my business, man. Dang, I'm doing a recording and now this way did. Oh, wait a minute. I can move and then come back to it. All right, let me go move my car. I'm blocking him. Give me 1 minute, guys. No, 1 minute, guys.
Somebody came to and the man came and put the tickets on the baby don't right inside the class.
Don't get it. Seja lá para baixo.
Yours are strong groups. I can see it. I can see everything. But this pull up everything. and straight. I can see everything clear as well. Huh? Okay. That's finished. That's finished. That's finished. That's finished.
Okay, let's see if it will pick up from where I left off. Mhm. Oh, right back on track. I like that about YouTube. I just discovered you can pause the recording and come back to it. Wow, that is good. Okay, don't be laughing at me. You know I'm not gonna pass it. Okay, guys. Okay, page 179. This explain what? What page? 179. I'm gonna get there. Slow down, slow down. Okay, so discharge is the patient going home. Okay, so focus, guys, focus. So step 1, 2, 3, and 4. That is basically your beginning step. So if they ask you to discharge a patient, okay, nurse says to you, Mr. John is ready for discharge. Okay, I need you to go discharge Mr. John. So what you do as a nursing assistant, number 1, identify yourself, identify the resident. So 1, 2, 3, 4, beginning steps. Number 5, vital sign. Number 6, inventory list, right? Number 7, personal items to be taken into the car with the patient. So you take him to the pickup area. Number 8, help resident to dress and then transfer onto the wheelchair, okay, or stretcher. 8, help patient say goodbye to staff and other resident. Take patient to the pickup areas. 11, wash hands. Number 12, document the procedure. Document vital sign, time of discharge, mode of transport, who picked up the resident, items that the resident took with them. Okay. So basically, the nursing assistant needs to know what to do for the resident at discharge. Make sense? All right. Okay. Let's talk about vital signs. Vital signs are important. Okay. They show how well the vital organs of the body, such as the heart and the lungs, are working. Okay. So vital sign is measuring body temperature, pulse rate, rate of respiration, and blood pressure. Okay. So with vital sign, if the temperature is high, patient has a fever, right? If heart rate is too high, you will know. Pulse rate is too high, you will know. Blood pressure not normal, too high or too low. How do you know that it's too high or too low? Page 179, you have the range. Okay. If you check when you check the temperature, you can check temperature by mouth, rectum, armpit, ear, and temporal or the forehead, temporal artery. The place where you work, sometimes they can use Fahrenheit. In the nursing home, the hospitals, most often they use Celsius. So basically, you can take a picture of this range of vital sign from your book, and every now and then you look at it. If the temperature by mouth is 101 Fahrenheit, is it good or is it too high or too low? If I say 101, something. If I say 101 temperature by mouth, is that too high or too low?
That sounds like too high.
That is too high. Very good, right? If I say temperature is 39.7 Celsius, is that too high or too low?
Too low.
39 by mouth. If I say 39 Celsius by mouth, is that too high or too low?
Too high.
Too high, right? So you look at the parameters, at the range for Fahrenheit for all the temperature sites. Rate, pulse rate. The pulse should be between 60 and 100 beat in 1 minute. If you check the pulse and you get, say, 115, is that too high or too low? If the pulse is 45, is that too high or too low? Too low. Respiration. Respiration rate range should be between 12 and 20. If your patient has 8 breaths per minute, 8, is that too high or too low? Breath. Is it too high or too low? 8. If I say 8, 8 is too high or too low for respiration? Too low, right? Same thing for blood pressure. Blood pressure, we measure it in systolic over diastolic. It's like a fraction, okay? But we will do more talking about blood pressure. Okay, page 180, all right? The normal body temperature is very close to 98.6 Fahrenheit or 37 degrees Celsius, okay? So the body temperature is a balance between the heat created by the body and the heat lost to the environment. So when we check the temperature, we're looking at, activities going on inside the body to create heat. Excuse me. But if your patient has illness, stress, if they were exercising, right? Some medication can cause the vital sign to be too high or to be too low. Okay? Now, when we check the temperature, we use an instrument that we call a thermometer. Okay? Common types of thermometers are, we have digital thermometers, electronic, tympanic, temporal, and mercury free. Okay? So the first one you have on 180, that's your digital. Next one is the electronic. So we use these two for oral temperature and axillary. Oral by mouth, under your tongue, axillary, under your armpit, right? But you have to open the shirt and go inside and put the probe directly against the skin and close the patient's arm on it, okay? Tympanic thermometer, that's for the ear. Temporal, that's the forehead, okay? Now, the thermometer, if it's green or blue, it can be used for mouth or axillary. Green or blue, we can use this thermometer for mouth and for axillary. But if the thermometer is red, we use it for rectal temperature, where you put the thermometer inside of the anus. Okay, we will talk more about that. Okay, now, when you use these thermometers, the electronic or digital thermometer, they beep, they work with batteries. Once they get the temperature really quick, they go beep, okay? But the mercury-free thermometer, it takes longer. We don't like to use that. We don't have much time, okay? Now, page 181. There are times when the nursing assistant needs to know that he or she should not check temperature by mouth. If a nursing assistant should not measure an oral temperature on a person who is unconscious, like in a coma, recently had facial or oral surgery, younger than 5 years old, confused, disoriented, sedated, seizure, coughing, or using oxygen, facial paralysis like a stroke patient. You cannot check oral temperature on a stroke patient because they have facial paralysis. Patient with an NG tube has sore, redness, swelling, or pain in the mouth, or injury to the face or neck. Now, measuring and recording oral temperature, okay? You don't take the oral temperature, page 181. If the patient had been drinking or eating or smoking 10 to 20 minutes before. So that means if your patient just had cold or hot water to drink, you wait 10 to 20 minutes before you check temperature by mouth. If I drink hot tea, now my mouth is hot. If I check the temperature by mouth right now, it's gonna say temperature is too high, I have a fever. But do I really have a fever? No. If I drink cold, if I eat ice cream, my mouth is cold. If I check the temperature, it's gonna say this person is very sick. Temperature is too low. So you have to wait 10 to 20 minutes. Okay? So identify yourself, wash your hand, explain procedure, privacy, put on gloves, beginning procedure steps. Put on gloves, put on a disposable sheet, a cover on the probe. Okay? And you will shake it and put it directly under your patient's mouth. Now, again, to watch, we have videos on YouTube and also on the Hartman site where you can check the temperature by mouth. Okay? Now, to check the temperature by mouth, you take the probe, you ask the patient to open their mouth, and then you ask the patient to lift their tongue. You put the probe under the tongue toward the back. Okay? Under the tongue, but all the way back. And then you ask the patient to close their mouth on the probe. All right? So they will close their mouth on the probe, and you say, don't talk while I'm checking your temperature. Okay? All right. Now let's talk about measuring. So the electronic or the digital thermometer will go beep when it's done. Now, the mercury-free thermometer, you have to wait, I believe, 5 minutes for the temperature to be accurate. All right. Now, for page 183, for rectal temperature, first of all, the thermometer top needs to be red or blue. Red. The thermometer needs to be the red one. Digital or electronic or mercury free. Step 1, 2, 3, 4, and 5 are your beginning procedure steps. Step number 6, you help the patient into the Sims position. Lying left side, one leg is straight and the upper leg is bent up at a 90-degree angle to the body. All right? Fold back the linen to expose the rectal area only. Put on gloves. All right? Now, whether you have a digital, electronic, or mercury-free, you clean up the thermometer, cover it up with a probe cover, okay? Apply small amount of lubricant, all right? And then you push it in 1/2 inch to 1 inch deep, okay? 1/2 inch to 1 inch deep. You only uncover the buttocks, okay? And then you don't push it hard in there, okay? You just gently push it in there. Page 184. For digital and electronic, you hold it in place until the machine goes beep. But for the electronic, you hold it in place for at least 3 minutes. Then you remove clean up the thermometer. Number 15, read the thermometer at eye level, digital or electronic. You clean and eject the probe cover. All right. And then you do your finishing up steps. All right. Measuring and recording a tympanic. Tympanic means in the ear. That's tympanic, inside your ear. Step 1, 2, 3, 4, and 5. That's your beginning procedure steps. We're on page 184. Number 6, you put a cover on the thermometer. Number 7, position the head so that the ear is in front of you, and then you will hold the ear back like this, right? Just like you see in the picture on 185, right? Hold the thermometer in place until it blinks or it beeps. You will hear beep, and then that's your temperature right here, okay? And then you practice your finishing steps. 185. Measuring and recording axillary temperature. Okay. Axillary is under the armpit. 1, 2, 3, 4, 5, and 6. That's your beginning procedure steps. Number 7, you expose the arm. So you will take off the shirt or just one sleeve. Okay. Number 8, you position it directly against the skin, right? Whether it's digital or electronic, directly against the skin, and close the arm on it, right? And wait to hear the beep. Okay? Go to page 186. All right? If it's an electronic, you also have to hold it in place for 3 to 5 minutes. Up for 8 to 10 minutes, sorry. All right. So you see why people like to use digital or electronic. It's very fast. Less than 1 minute, boom, done. 15 seconds, done. All right. After you take it out, you read it, you clean it, you clean up the material, record and document, and then you're finishing up steps. All right. Page 186. Let's talk about pulse. Pulse is the number of heartbeat per minute. The beat that is felt at certain pulse point in the body represents the wave of blood moving through an artery as a result of the heart pumping. So every time the heart pumps, the heart contracts. It pushes blood through the vein, right? So if you touch your pulse here, your radial pulse, you start with the thumb. If you go here, right, you will feel pulse just moving, right, through your artery, all right? So we check, nursing assistant, we most often check the radial pulse, okay? Radial pulse, right along the thumb, around the wrist. Here you put 2 fingers, you keep pushing and looking until you find a beat under 2 fingers. Okay? Same thing for brachial pulse. You go around the elbow here, on the inside here, you put 2 fingers, you press down, right? And then you will feel a movement. Boom, 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 under your fingertips. We have a video of how to check the pulse. So you're gonna watch that video, and this is one thing we will practice also next week. So next week when you get here, it's all gonna be practice, 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 and nothing but practice, okay? All right, so the normal pulse, so pulse can be checked. We got temporal pulse, carotid pulse, apical pulse, which is the heart, brachial, radial, femoral, popliteal, and pedal pulses. All right. Now, exercise, medication, and illness can affect the pulse. The normal pulse rate is between 60, and 100. All right. Now, next, let's talk about respiration. Respiration is the number of time a person breathes in 1 minute. One breath is one inspiration and plus one expiration. Inspiration is breath in. Okay? Inspiration is breath in or inhale. Expiration is breath out. So patient will go, that's inspiration or inhale. That's expiration or exhale. One breath is one inhale plus one exhale. Okay? So in and out is one breath. The normal respiration rate is 12 to 20 breaths in a minute in 60 seconds. So as you're checking the pulse, you're also looking at a clock. You're going to need a watch with the little third hand that goes around. Same thing as you check your respiration. If your respiration is 15, it's good because it's between 12 and 20. If it's 14, good. 15, 16, 17, 18, 19, 20, very good. At 21, 22, 23, we start being suspicious when we report that right away. Okay? We have videos that you can watch on Radio Pulse and checking respiration. State exam, when they ask you, according to the directions, if they ask you to check vital sign, they want you to check pulse and respiration, and we will go over that with you. Okay? So, 187, identify yourself, wash your hand, explain procedure, privacy. Okay? So 1, 2, 3, 4, beginning steps. Number 5, place two fingers, the tip of your fingers, middle and index finger on the pulse. Press down a little bit. Don't do it with your thumb. Just do it with these 2 fingers. Okay. Count the beat for 1 full minute. Number 8. Keep the fingertip on the resident's wrist and count the respiration for 1 full minute. So when you check the pulse and the respiration, the patient doesn't need to know which one exactly you are doing. So while you have your fingers on the pulse, after that 1 minute, you don't say anything to the resident and you start counting the respiration. Okay? As a matter of fact, I'm thinking we might do pulse and respiration next week. Okay? Respiration is 1 breath in, 1 breath out. So the way you count respiration, you look at the shirt. Okay? Now, if you're looking at my respiration, you can see the shirt. You see the shirt going up and down? Up and down, that's 1 breath. Up, when you breathe, your chest go up. When you breathe out, your chest goes down. All right? So you look at up and down for 1 minute. All right? Page 188. Blood pressure. Okay? Blood pressure is an important indicator of health. All right? It is recorded as a fraction. The measurement shows how well the heart is working. Blood pressure is measured in millimeter mercury, recorded as a fraction. There are 2 parts to blood pressure: the systolic pressure and the diastolic pressure. The systolic phase, this is the top number. The heart is at work. The heart is contracting. The heart is beating and pushing blood out of the left ventricle of the heart. Okay? The normal systolic pressure is I would say 100 to 120. The second number is the diastolic, okay, which is the bottom number. This is when the heart relaxes. The diastolic measurement is always lower than the systolic measurement, okay? The normal systolic pressure, diastolic pressure is 80 millimeter mercury. When blood pressure is consistently high consistently elevated, we call it hypertensive or high blood pressure. Okay? Hypertension is what we call high blood pressure. Remember that information from chapter 4. Okay? That information is on chapter 4. Okay? You can measure blood pressure manually or with a digital sphygmomanometer. My recommendation for you students is to buy the manual blood pressure cuff so that way you can get a lot of practice. Checking the blood pressure is very difficult skill to learn. Okay? Nurses, CNAs, doctors have a very hard time getting it the first time. But you do it a few times, it's really good. Plus, you're going to look really good when you have the stethoscope around your neck with your nursing uniform. Okay? So next week, everybody come to class in uniform. Buy yourself a stethoscope, put it around your neck like this, walk around looking like a super nurse. But only you and God know you're a CNA student. Okay? Shoot. Of course, why not? Dress like your future. Okay? All right. So we use a machine. We use a machine, an instrument we call stethoscope. It goes in your ear to listen. And then we use another machine called sphygmomanometer. Or you can just say blood pressure cuff. Okay? Now, do you want to say sphygmomanometer?
Yeah.
Okay. Now, repeat after me. Look at it. Look at me. Repeat after me. I didn't go pss. I say no, damn it. Okay. Speak. 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 Sphygmo. Sphygmo. Spig. All right, don't talk. You're retarded. Sphygmo. I said don't talk. No, go ahead. Repeat. Sphygmomanometer. Sphygmomanometer. All right. You see that? Page 188. Sphygmomanometer. Very easy. Okay. Now, you check the blood pressure on the arm. Upper arm right here. You will wrap the arm with the machine. Okay? And then that's where you would check the blood pressure. Now, you check the blood pressure on the right arm or the left arm. Don't check the blood pressure more than twice on one arm. If your patient had breast surgery, don't check on the right side. Do not check the blood pressure on the right side. Get it? If your patient had surgery or any problem on one side, don't use that side. If your patient has an IV on the right arm or the left arm, stay away from the arm that has the IV. Stay away from the arm where they had breast surgery. Stay away from the arm. Do not use the arm where they had any problem like dialysis on that arm. Okay? So, page 189, number 1, 2, 3, 4 is beginning procedure steps. Number 5, using a stethoscope, wipe the diaphragm and earpiece with alcohol wipes. Number 6, ask the patient to roll up their sleeve. Number 7, position the resident arm with his palm up. I need quiet, guys, so I can do this. Please, if you're leaving, do it quiet. Please. Okay? So, position arm with palm up. All right? And then number 8, with the valve open, squeeze the cuff. Make sure it is completely deflated. All right? So, All right, guys, class dismissed. You can go. It's okay. You can go. You can get the rest of this on YouTube when I finish with it.
Okay.
All right.
Thank you.
You can't concentrate anymore.
Okay. Later, same time.
Yeah. It looks bad if I have to keep doing this on YouTube. So
See you.